communicationplatform.org, and we are going to get started here with our talk on heart health, community healthy programs for our Heart Healthy Neighborhood campaign. So here we go. All right, typical disclaimer. Nothing is medical advice. This is strictly informational. Always follow your local and regional, national healthcare laws, and have you or anyone else, work with their own licensed healthcare provider, physician, to go ahead and talk about, any exercise program, any new medicine or supplement, all that. So this is strictly informational only. Informational only. Never to be taken as medical advice. Now that we got that disclaimer out of the way, we got a lot to cover. Our world, our fight, our choice. Here we go. This is right out of the protocol for our Build a Town protocol, out of the medical healthcare cardiology section. So let's do it. We've had people, our team, which by the way is a volunteer humanitarian team. We are, we don't do any donations. We're not an official organization or nonprofit. We are just a group of professional volunteers and community leaders throughout the U.S. And all the way through Africa, Asia, Latin America, where we are just helping out communities at risk, which unfortunately is most of the world nowadays. So we've had this particular Heart Healthy campaign program done by many nurses, local doctors, actually even community volunteers, local NGO nonprofits, and even just neighborhood leaders and neighborhood community leaders, people with just secondary school or even not even secondary school education, who have taken charge and done this and prevented heart attack and stroke and, prevented death in their country from cardiovascular disease. So they should be very proud of themselves. That's amazing. This is not a money thing. It just takes time and effort. Let's talk about why it's so important. So violence is everywhere. Of course, war, bullets, bombs, all bad. And taking innocent life, we don't want anything. But when we talk about, all the civil war and all the actual, state war and all the gang violence and all the tribal conflict war where we've been, actually, heart disease, cardiovascular disease still kicks its butt. You can't compare the numbers. Cardiovascular disease, heart disease kills way more. Let me emphasize that one more time. Heart disease, even in war-torn countries, heart disease is still what most people drop dead of. So we got that clear? Let's keep going. In general, so this is just the general pathway, and we have a wide audience, doctors, nurses, and public health workers, and just, again, community volunteers who are not working professionals in any way, that just do our program, which is beautiful. But normally, for heart disease, the pathway goes, if somebody gets screened every year by a local physician, and then their healthcare provider may see, whoa, you're at risk for heart disease. You might have to be on a certain blood pressure medicine. You might need to take a little thing called a stress test, where you walk on a treadmill for a little bit, and we see if you need something called, a heart catheter, which you lie down on a table for a half hour, and somebody goes inside your arteries, usually through the femoral vein in your leg, and they look with a little camera through the arteries. They're looking, and they're actually seeing is their blockage in the arteries. So if you take your fist and wrap your fingers around it, that's your heart arteries, your arteries that wrap around your heart. When you start getting blockage in the arteries and veins, you get blood clots, you get stroke, you get heart attack, you get all this horrible stuff. So most parts of the world we work in don't have that capability. So this is why this is so important. So you can go to communicationplatform.org, and you can look at the table of contents, and then you can look at our Build a Town protocol and go to where we show you right here in the red, and go ahead and just and do this. Okay. Cardiology, we're referring loosely to the cardiovascular system, and this is a list that you go through. So it's like we would say the best heart health for your area, your village, your town, your community, your neighborhood, your city, would be going through each of these checkoffs we're about to go through. And again, it's all clearly laid out there in our document, in our cardiology section. So you can go online and grab that. I'll download all this stuff for free. This is all free. All right. And again, you would get it in the Build a Town protocol. You'd go to the website, click on Build a Town protocol. It's under Community Leaders Free Resources, I believe. Click on the Build a Town, put in your email, get it for free. and then go through and get to the table of contents, and you'll see everything. And what we're going through is, for the community leaders, this cardiology section, okay, for neighborhood specific leaders. Usually, for per street or per group of streets, it's like one community, one neighborhood leader for like 3 or 4 streets. So, maybe up to 30 or 40 families, depending on the population and density. So you can either find people to be the volunteers, the neighborhood volunteers to do this, because you're not going to take on your whole town or your whole city yourself. Or you yourself can just do this for your own local few streets and your own group of families. But it's better to share it and get other people to do it too, because you want everyone to change. Let's see. So you want to check off each item as it's actually done. So the first thing for people you find as neighborhood specific leaders, or you yourself, if you want to be the neighborhood specific leader for your own neighborhood, is you're going to give them, and again, this is in the cardiology section of our Build a Town protocol, which is all free. It's a huge PDF file. And you're going to go to the My Healthy Heart section in the cardiology section, and you're going to give that handout page to everybody, and it goes through everything that we're about to talk about. So you want to make sure they have paper copies. You want to make sure all 30 or 40 or 50 families in your area that they all have the My Healthy Heart handout page. Super, super important. Okay. You want to go ahead and actually talk about this page, on a Friday night or Saturday night. Hey, did you look at that? Because it actually matters. Because an educated local population, if they're motivated and educated, they will cut their heart disease, their cardiovascular disease, really in half. And I believe they will just, save lots of lives. All right, so the first thing on the list. So you handed out everything. That was number 1. Now, number 2, let's talk about what's on the list. High blood pressure. Silent killer, 2 pinches of baking soda and a glass of water every day with lemon or lime juice. Very safe, simple remedy, effective for most people. Usually gets them down 10 to 20 points systolic. If you don't know what that means, it just means that they get, your blood pressure is a top number over a bottom number. We want the top number to be 130 or less, most people, and the bottom number to be 90 or less. So let's say there's a guy down the street from you, his blood pressure is 160. He's at some kind of risk. But maybe we can get that top number 160 down to 140 just by doing this. Maybe. Again, this is information only, but this is what we've seen work. Apple cider vinegar, a couple spoonfuls could be added too, but that's very hard to find in a lot of the places we work. But baking soda and lemon and limes are everywhere. Okay. Next one, number 3, community exercise. This is not just walking to work every day. Lots of developing countries, people are on foot walking in every day, morning to afternoon to night to where they're going. That's good. That is exercise, but we're talking about cardio heart exercise, sweat exercise. Take your age, and you're going to do 180 minus your age. So if you're 50 years old, 180 minus 50 is 130. That's what you want your pulse to be during the 20-minute exercise. That would be that example. So for a 50-year-old, you want the pulse to be 130 per minute, heartbeats per minute, or greater than 130 heartbeats per minute. What would we talk about as cardio exercise? Well, it's not walking. You've got to do faster than that. It could be like martial arts, boxing as an example. If you do very intense farming, shoveling, could do running, jogging, community dance, or just dancing. But it's got to be really moving continuously, sweating for 20 minutes. Bicycle is a good one. Okay. So you want to get your community doing that. You want to really get them doing that if you can, because that's a huge part of it. And I would say at least 3 days a week, but I mean, the preference, if you can do it every day, that's all the better. And as a reminder, disclaimer, people need to talk to their local healthcare provider before taking on any kind of exercise activity. All right, 4, diet. So you just want to get rid of the fried and fatty foods in your neighborhood, in your village, in your community, because street food has plagued, unfortunately, not just the West now, it's all over the world. And it's not good because it's bringing heart disease to places that can't handle the heart disease. So you want to go back to your gardens, your food farm, your vegetables, your salads, your fruits. So it's very important. Get people to, stop buying from street food vendors or local restaurants or shops that only do fried food, have them stop going. And eventually those restaurant owners, or the shops will say, uh-oh, nobody's buying. We got to change up our menu. So it has worked, and it will work. Number 5, get rid of smoking tobacco, chewing tobacco, any kind of cigarettes. This is a must. Basically take a jar with honey, half honey, half radish, tiny minced up radish, cut it up in little pieces, and take a spoonful every couple hours. You don't have somebody stop, all at once smoking. That will be bad. You would have them just cut their cigarette use or their tobacco use in half. So for the first week, if they smoke 20 cigarettes or a pack a day, that would be 10 cigarettes a day for the first week, while they take some spoonfuls of their honey radish mixture. And then week 2 would be cutting it in half again, from 10 to 5 cigarettes. And then by week 3, then they can stop completely. Very effective old Chinese remedy for tobacco. So use it, get people off cigarettes and tobacco. Okay. 6, community blood pressure machine. Yes. You need, for just $20, 20 US dollars, which is really nothing, your entire village or town area, or neighborhood area at least, can have somebody that you trust, or you or some volunteer, can have that blood pressure machine and just check people's blood pressure every time you get together. Make it a habit every week. Remember the magic number, 130, the top number, 90, it's 90, the bottom number. If it's more than those on the top or more than that on the bottom, then you got to do some homework about fixing their blood pressure. Okay. And depending on the country, you could even get your own blood pressure medicine. So that would be, for most people, amlodipine is the best. That's a great one to start with. 5 milligrams is a good safe dose. But there's different ones out there. I would remind people that if a woman is under 50 years old, I'm not kidding, under 50, I would consider childbearing age. And I would be very careful, because there are blood pressure medicines that are not safe for childbearing women of childbearing age. It will kill the baby, and it's a bad thing. So you need to pay attention to that. We'll talk about that in a minute. But in general, this is a good list for, non-pregnant or potentially pregnant women. We do have substitutes, by the way, for women who do have high blood pressure. There's other blood pressure meds called beta blockers, or certain calcium channel blockers or beta blockers that are okay during pregnancy. So let's see here. Number 7, talking now about cholesterol. Well, there's special medicine for that called statins. There's actually lots of herbal supplements, herb regimens that are just as effective, in my opinion, as statins. But I'm not gonna. I gotta stick to the script here, because we got to get through this. But in general, the first, before you can even know if you need some kind of herb or statin, cholesterol, heart medicine, you have to know, do you have high cholesterol? So you have to get it checked. So that's one challenge. People who can get it checked should. Many people who cannot get it checked can still make some obvious decisions about if they need a cholesterol medicine. I'll give you a hint. If they've had a past stroke, they need a cholesterol medicine. Blood clots, they need probably cholesterol medicine. Heart attack, definitely cholesterol medicine. If they have a strong family history of cholesterol, probably need a cholesterol medicine. Diabetics need a cholesterol medicine. Okay. And a baby aspirin, for that matter. Usually those go hand in hand. So I often tell people, if someone needs a cholesterol medicine, they probably need an aspirin, a baby aspirin, daily as well. But first, who should not be on cholesterol meds? Any pregnant woman should not be on a statin, that specific type of med. Although a pregnant woman could take aspirin safely. Aspirin is not scary in pregnant or could be pregnant women. Statin cholesterol meds are. Any woman under 50 who could become pregnant should not be on a statin. Any person with liver damage, especially active hepatitis or alcoholism, alcoholics that are abusing alcohol, should not be on statins. Anyone Yeah, and that's not totally true. There are some forms of liver damage that could be on a statin, but again, that would all have to go through a local physician, a provider, to keep an eye on that. Anyone who has taken a statin cholesterol med before, who had got lots of body pains, body aches, or joint pains, that could be something called rhabdomyolysis, and that person should stop taking their statin and talk to their doctor right away. And then for aspirin, nobody with ulcers or active bleeding issues should be on an aspirin. Well, because it's like a blood thinner. It's actually an antiplatelet, but it's not good to have, major problems or history of bleeding ulcers or stomach bleeding. That would be not good for aspirin. Okay. Or I would add to that somebody who has active bloody stools. So somebody who says, they see blood every time they go to the bathroom, they also need to be careful of aspirin and get that evaluated first. All right. Assuming those things are not an issue, then you would go ahead and look at aspirin 81 milligram. That's, by the way, the delayed release version, plus a statin. So atorvastatin, there's pravastatin, simvastatin. Many countries that have statin access. Atorvastatin 40 milligrams is the most popular. Number 8. Okay, this is the fun part, the heart healthy test. So you're going to have like a group of all the adults in your community. Children don't need to do this, right? This would be for adults, typically usually age 30, 35 and up, where they're just going to go ahead and walk for 21 minutes. And some person, a friend of yours, will be in a Jeep or a motorbike or a car or whatever, but something that keeps track of the kilometer per hour, that they're going to look on the odometer for the kilometers per hour. And they're going to go ahead and they're going to set a pace for 21 minutes down a long street, a long road, or a long group of streets in your area. And you want to make sure the area has a little bit of incline, because the actual real test has an incline, and that, on the treadmill, because we're replicating a treadmill test. This is for areas that don't have the ability to do this special treadmill test, in a cardiology place. So you have to protect their lives and want to kind of intervene and detect any kind of heart risk. So you're going to replicate it. You're going to do this by just using a group of long streets that you can keep walking up and down. And it's preferable if a couple of them have an incline going up. Doesn't need to be really steep. You actually do not want it to be a very steep incline, because that's not fair either. You want it to be a mild incline, like a slow, small hill. And you want to go ahead and do that. Also, very important, each person needs to have their own watch or a timer or phone, because each person during the 21-minute walk that they're following the Jeep or the motorbike, they need to keep track of when they stopped walking, because most people, most adults, believe it or not, are not going to last the full 21 minutes during this walk, because the walk gets faster, it speeds up, it gets harder. So people, when they quit, if a woman quits at 10 minutes and she says, oh my God, it's too hard to breathe, I got to stop. Well, her magic number is 10 minutes, because she quit at 10 minutes, even though the whole walk lasts 21 minutes. You have to know what that number is, what minute they stopped walking and gave up, because otherwise you can't do anything with this. Okay. Now that car or a motorbike, we usually use a motorbike, somebody that has, with the odometer, the kilometer per hour, to keep track of pace. They will slowly speed up every 3 minutes over 21 minutes. So they'll go 3 kilometers per hour for 3 minutes, then 4 kilometers per hour for 3 minutes, then 6 kilometers per hour, then 7 kilometers, and every 3 minutes, you get it, they're going to speed up a little bit. Anyone with a history of heart problem or active chest pain, should probably not do this, especially if there's not a clinic or hospital close by, just as a disclaimer. And then now that you have your group of however many, usually it's, even like I said, up to 30 people in a group walking, you're going to go ahead and you're going to do this simple, you're going to do the walk. And after the 21-minute walk, you're going to do this simple equation. There's actually 4 equations. There's a little math involved. Don't be scared. You're smart. You can do it. The 4 equations are for women 40 and over, women 40 and under, men 40 and over, men 40 and under, men under 40. So it depends on their, the sex, women or men, and then their age, 40 and over or under 40. Okay. Let's use the example of let's go young. Let's go 36-year-old woman. She's doing this walk. She's in your crowd of people. Let's say this 36-year-old girl only makes it 9 minutes. Her magic number is 9. Do the equation. Remember that first equation? Which equation would you be? Which do you think? She's 36 years old and she's a woman. Right. You would use the equation, obviously. Women under 40, because it's a woman, she's 36, which is under 40. So look over, and what's that equation? The heart oxygen number is 4.38 times her minutes minus the number 3.9. So let's do it. So 4.38 times 9, and that is going to be minus by, and then you're going to minus 3.9. So 4.38 times 9 equals 39.42. Then you're going to take, you can just round it, 39 minus 3.9, excuse me. And then that would be 35.52. So what's her magic heart oxygen number? It is 35.5, roughly, 35.52. Okay. That's in the blue. Now, you got to look at this chart. You have two simple charts that the public use for the heart test, the protocol. To the left, women. To the right, men. On the left, women. How old was she? Look at the age column. She was 36. So you're going to have to look at which column? You're going to have to look at the 35 to 39-year-old because she's 36 years old. So look between 35 to 39-year-old. And what was her magic heart oxygen number? 35. So we're looking at the 35 to 39-year-old going across. And with my finger, I scroll across. Oh, excuse me. I'm on a touch screen. My bad. And you are going to go ahead and you are going to look across. Here, use the mouse. You're going to say, okay. So what was her number? 35.5. She's right around here. So she's 36 years old going across here. And she's right about here, average. 35.5. So she's roughly at 35. 35, look up, average. So she's average. Well, who are the people you're worried about for their heart? Anybody who falls in the very poor category, the poor category, or the fair category, we would say, is general information to consider recommendations of, talking to their healthcare provider, their nurse, their doctor, whoever, about aspirin 81 milligrams daily, and also, being on potentially a statin, a blood pressure medicine. They need to keep an eye on their heart. Anyone who falls into the very poor, or fair category, those numbers for their heart oxygen number, if that number brings them into the very poor, or the fair category, you should be concerned about their heart. They should really consider, maybe not in all cases that, if this lady who's 36 had scored very poor, I don't know that I would put a 36-year-old on aspirin, maybe, but it would depend on her family history and other things and other risk factors. But she needs to definitely do the heart healthy handout in general and see a doctor if possible, because that's somebody you should be concerned about. So this helps you risk stratify your community. And then that's pretty much it. There it is. Everybody can fill out this if they can for us. These are the big things, which is every piece of information that we like to keep track of, which area, that's pretty much it. Where how you heard about us, and did you follow all this protocol, all the topics? If only some parts, why? What is your position? Again, we work with lots of nurses and doctors and public health workers and hospital and clinic directors, but we work with a lot of non-medical people too who do everything we just said. Okay, so you can answer all those questions. That helps us out to know about your area and hopefully help us help you. That was it. Email opensources123@gmail.com if you have any questions. And again, take charge for your community, for your community's health. You should always follow your local and state and federal government laws, regarding, health and medicine and healthcare. But we really want to see people step up if they're able to do so, because the world is hurting and it's only going to get worse. And cardiovascular disease, even as more wars and gang violence and things break out, but you know what's going to kill most people still? Cardiovascular disease. So do the Heart Healthy program. Make it happen. Talk soon. Bye for now.